Okay. Okay. Delia, I have the results for the both biopsies. I am sorry to say that it was positive.
Okay, and so it was positive in a lymph node and in the breast, or?
Yes, dear.
Okay.
Yeah.
All right.
Do you have any children?
No.
Okay. Yeah. Just to have a consultation, like, with your OBGYN. Also, like, now that you have this diagnosis, if you're planning for kids, having ovaries freezed or something. I mean, this is something that I'm suggesting, but I'm, again, not knowledgeable. But you can have a discussion with your OBGYN.
Okay, sounds good.
Okay? Okay? Yeah.
Okay, thank you.
I'll be seeing you again, like, in a few days for the other biopsies.
Okay, that sounds good.
Okay. Okay, dear. Bye.
Thank you for that.
Yes, it is true. I have a breast cancer.
We have not made a video in some time, we know, and so now you know a little bit about what we've been going through, and it's been a lot, and we now finally feel ready to talk about it a little bit, and this is our new journey.
So I will throw it back to December because that's initially when everything happened. I went home for a little bit to visit my family and be with them for the holidays. And while I was out there, I felt a weird feeling in my chest. So I went in and saw my OBGYN. She did a breast exam and referred me to get an ultrasound to make sure everything came back clear. When I went to do the ultrasound, it was a very long appointment. I've had one previously, and this one exceeded it by like 3 times, so it was a little bit concerning, but she started doing the left side, started measuring things, which was a little bit weird. I'm like, why are you measuring them? Like, what's going on? She's like, there's just a few lumps, and we just need to make sure that they're under the size of what we typically see. So after she did the exam of my breast area, she's like, I think we should look at the lymph node under the arm. And as soon as she started the scan, I just happened to look up at the screen and I noticed that there was a big black shadow that was registering under the arm. And I asked her, like, okay, what is that? Is that normal? Like, she's like, well, it's a little bit weird, but I think we should have you do a mammogram and just get a little bit more imaging that way. So she finished the underarm on that side, and she's like, I'm going to check the right side just to make sure everything looks good on that side, and it did. It came back clear, thankfully. So I went across the hall and we did the mammo, and the mammogram results came back, and there were a lot of white spots all around the top part on the left side of my chest, and that registers as calcifications. Knowing what I know now, calcifications are very apparent for like some sort of cancer. So they didn't tell me that in the appointment because I think they didn't want to get me upset or just cause me to worry when we really didn't have a lot of information at that time. And she's like, okay, I think we should have you do an MRI and just get even deeper scanning. And so the following couple of days later, I went and I had an MRI done, which, let me tell you, that was an experience of itself. I hadn't had one done before, and luckily I'm not claustrophobic, but the machine is very loud and you're in and out a lot, and it's like a really tight space, and it was just a little freaky. But anyways, we got through that. We got the results back, and they came back as a concern again. So she recommended me to get a biopsy done. And with that experience, they take a needle into the breast and inject the hard lump or the hard surface that they see on the scans that we did previously. And they did like a local anesthetic, so I was a little bit more comfortable, inserted the needle and withdrew tissue. They did that for the left breast in the concerned area, and then the lymph node And 2 days later, the doctor called and told me that it was positive.
At this time, I was out in Arizona with her. She was out with her family because, we knew something was going on. So I headed out there and I was with her for a little while, but I had to head back for work. It's been extremely busy with home building with our jobs in Utah lately. And so I had to head back, and the doctors told us that we'd be getting the results later that week. And I just needed to be back in the beginning of the week. So I just said, let me know the results, and depending on what they are, I'll have to come back out here, but I just need to go back home and take care of some stuff at work. So I was actually on the flight because we got the results early, like several days earlier than we anticipated. I was on the flight. I texted her, babe, flight's about to take off. I'll text you when I land. And flight takes off. We've been in the sky for about a whole minute. My phone rings, and it's been maybe a couple minutes in the sky. I'm thinking, it's my wife, it's Delia. And I'm thinking, I say my wife because it says my wife. I'm thinking, how is she calling me? As I pick it up, and she's just sobbing. And she says, it's positive, and she was distraught. And what do you say? And I just tried to comfort her. Babe, I'm so sorry. I will get back on the flight as soon as I land and come back. And just kind of hearing her cry and just me trying to comfort her, and then just call cuts out. I knew it would. I was surprised that it even connected in the first place. And that, let me tell you, in that moment, that was one of the longest, hardest flights of my life. Having to wait in midair, knowing how my wife is feeling, knowing that she's alone, I'm not with her, and that was tough. And as soon as I landed, I called her, and we, kind of that sudden realization, like, okay, this is our new journey.
So after receiving the call, I remember my mom was in the living room, and I was just pacing. I was just pacing back and forth in the room, and I was just like going like this and just like shaking my body because I was just like didn't know what to think. And my mom said, I have to go. She's a recruiter, and so she was on the phone with a candidate, and she said, I have to go. And all I said was, it's positive. And I just collapsed. And I fell to the ground and just was crying, and I called Dylan, and then I lost him, like what he explained, and I just cried the whole day. My mom just laid there, and we just laid there and we cried together, and that whole day I was just numb. I didn't know what to think. I didn't know how to process. I wasn't expecting it because the whole time through my scans, I was just like, no, I don't have cancer. Like, I'm fine. I'm healthy. It's just calcium buildups. I just was trying to tell myself everything I could to keep myself positive, and cancer was the last thing I would expect to have, and hearing a positive result was the last thing I thought would happen. And so my mom got on the phone and started calling the hospitals to get an appointment as soon as possible with an oncologist. And luckily, we have a hospital, which is one of the best in the country, MD Anderson Cancer Center, like a mile away from our house. And they got me in 2 days later, and I met with the oncologist and had a long meeting with her going over everything. So that's kind of what we wanted to talk to you guys about today, what my breast cancer diagnosis was. They diagnosed me with stage 3 invasive ductal carcinoma. It stems in the milk ducts, and the way they diagnose you is based upon a few different things. So TNM is how the first part breaks down. So T stands for tumor, N stands for nodes, M stands for metastasize. So we didn't know exactly how big the tumor was, but the pathology report came back that it was bigger than 5 centimeters. We initially didn't know. After exams, multiple exams, they figured out that it was between 10 to 12 centimeters, and it has like the shape of a finger is how they described it. So it starts at the top part of my chest wall, which it's really close to, as well as my skin, and it kind of goes down and then over to my lymph node. So that came back as a T3 because of the size being larger than 5 centimeters, and then the N stands for lymph nodes, which basically at this point there was only one lymph node that was involved. And then the M part stands for metastasize, which we didn't know at that point in time. Metastasize means if it has spread throughout your organs or any other part of your body. So it was T3N1 is what the initial diagnosis was for that, and then the stages are stage 1 AB, stage 2 AB, stage 3 ABC, and then stage 4. And because of the size of the tumor, she said it was in between a stage 2 and 3, but most likely a 3B because of the size of the tumor again. So that was really alarming to me because I hadn't felt the lump in my breast that long, and for it to be already 10 to 12 centimeters was really, really big. So that's how they basically gave me a stage 3 diagnosis. They have different grades 1 through 3, which basically breaks down how fast the tumor is growing, and I was a stage 3 out of 3, so she said this is a really aggressive, rapid growing tumor that we just can't wait on. So mine came back being 97% positive for estrogen, negative for progesterone, and negative for HER2. And basically that means that my body is using my estrogen to grow the cancer cells. So it's feeding off of my estrogen. So with this diagnosis, it being a T3N1 stage 3 invasive ductal carcinoma, that's really fast and aggressive growing. Their recommendations for treatment were chemotherapy, surgery, radiation, and then a hormone blocker is basically the whole treatment plan. And so the regimen that they wanted to put me on for chemotherapy is ACT. It's one of the most intense regimens. The doctor told me, you know, we have older patients come in here that have 15 to 20 years to live, and here you are 28 years old with this diagnosis, and we're looking for you to live 50 to 60 years, and we want to be aggressive. So it's 5 months of chemotherapy. Then they want to do a surgery to make sure and remove everything out of there, all the cancer cells as much as they possibly can, and then do radiation after to kill any microscopic cells that could be left. The reason that they recommended chemotherapy first is because they want to shrink the tumor and have something to watch, and they want to pull it away from my chest wall, pull it away from my skin. That way I have a better outcome for surgery, and they don't have to completely take all of the skin and all of the tissue inside. They can just remove the infected area, and then we can do reconstructive surgery. So after having this consultation with the oncologist, she recommended a few things. She wanted me to get an echocardiogram so we can check my heart, because chemotherapy does take a toll on your heart. It takes a toll on your whole body, but especially the heart. And then she wanted me to do a PET scan, which basically is a full body scan that looks over and it highlights any parts. It turns red in parts that might be infected or contain like active cells, which are usually cancerous. So we did the PET scan, and this was like one of the best days throughout this whole journey. That leading up to it, I was so nervous because it shows if it's spread anywhere else in your body, and we did the PET scan and everything came back negative. It's not in my liver, it's not in my lungs, and it's not in my bones, which is where the cancer tends to spread first. And I was so relieved. It was like a day that I was just like on a high. And I haven't really been emotional that much throughout this journey, but today for some reason, I had a day this past weekend that I was really emotional, and then today, just talking about everything again, things have happened so fast,
that we haven't really had time to really be emotional, especially her, and like process it. We've had to just so many tests and doctor's appointments. And
I remember just like I would get like 50 phone calls a day from different doctors and like keeping track of everything. At the end of the day, I was like, I'm so exhausted. Like I'm just so wiped out. And every single day up until this point, basically, we were meeting with doctors, and we're meeting with radiation oncologists, medical oncologist, breast surgeon, like getting PET scans, echocardiograms, scans, like so many different scans and tests done. And then we had fertility preservation, which is another thing in and of itself. It was recommended by the medical oncologist to basically go through the first few steps of IVF and do some fertility preservation. They gave me basically said you have a 50-50 chance of being fertile after chemo.
As you guys know, we have struggled with infertility. That's a huge part of our future, we still feel like, and that was really important for us to preserve her eggs. Seeing what she has gone through the past couple of months. So first of all, the fertility treatment. She's taking supplements that increase her estrogen dramatically. The very thing that we feel like could have been the cause, one of the main causes of her cancer, since it does feed off estrogen. So we do feel like that the fertility treatments prior to this could have been, you don't really know, but it could have been a huge cause. And so we had to make that decision that, of course, we want children. It's something we want more than anything in the world. And so we had to make that decision that we're going to be giving her body the very thing that cancer feeds on, her specific cancer feeds on, just to be able to do that and preserve her eggs for the future. And it just took a lot of faith, took a lot of prayer, and to immediately turn around and take supplements that suppress her ovaries and suppress her estrogen. It's been a whirlwind. And for any woman to have to go through the stages that lead up to fertility, to immediately have to take supplements that put you into a menopause state, which she is in right now, it's literally both extremes, and in everything that comes in between with emotions and side effects. And I can say I'm so extremely blown away at the strength of my wife, at the strength of Delia, and how she has gone through everything with such grace. And it's been a very huge eye-opener to me. And we know where her strength truly comes from deep inside, but I know she's being lifted and carried through this. And I see it, and we both see it as clear as day, that the only way we were able to get through this and get to where we are now, and she is through the grace of God, truly. And we've been so extremely blessed.
So I just wanted to say thank you. Here we go again. We've had so many people reach out via like Instagram and Facebook and YouTube and just personal messages, checking in, because we have chosen to make our life public and keep you updated with, our like infertility journey and like what we're doing for work now with Chatwin Homes and our design company. And we just try and share as much as we possibly can. And I think initially when I was going through everything, I was so overwhelmed, and I was processing, and I was like researching everything, and I was preparing for chemo, and there was just so much on my mind, and then my fertility, and just so much that I was like, I can't do YouTube right now. Like, I just need a break. I can't do Instagram. I need to just go within myself and just really focus on like this child that I have in front of me. And I just want to say I'm so thankful and so grateful for all the people who have who've reached out and who've sent nice messages and just checked up on us, because we feel this heaviness. Like, it's been 3 months since our last video, and we want to like be able to like communicate with you guys and talk with you and like share what's going on in our life, and we just haven't been able to do that. And I'm just grateful for those people who have reached out. And I just want to send a message to not just like women out there, but men too, whoever's watching this video, that first off, our bodies are so strong and they're so capable of overcoming anything. And if we feed it right, if we give it its nutrition, if we exercise and do all of those things to keep it healthy. But it's so important to go to the doctor if you feel like something's wrong. And as soon as I felt that lump, I was like, I don't care if it's negative or if I'm just being overly cautious or whatever. I would rather be overly cautious than have something in my body that is not helping it or is not impacting it in a positive way. And it's just so important. Like, if you have any inkling or any feeling that something is off, go see a doctor, go get checked out, do a womanly scan, like early, get a mammogram early if you feel you need to, like check in with your doctors and just stay on top of your health because it's so important. I had no symptoms. I didn't have any uncomfortableness when I slept. I didn't have any tingling or itching or pain or anything. I literally just felt it before I got in the shower one day. And I'm so grateful that I found it in a time that I'm able to cure it and it's treatable and it hasn't progressed to stage 4 where the chances of curing it is very low. I just want to send a message to you guys to just stay on top of that and to take care of your bodies and listen to it because it does communicate to us.
As you guys know, I had testicular cancer and luckily caught it early as well, but I did nothing about it until I felt the pain of it one night. And, you know, one of them was extremely solid for several months. I did nothing about it until I felt pain. So this is also for all you men out there and all you women watching. Have your husbands or brothers, fathers, go get checked. Like she said, why not? It's your body. And there's a lot of times that we focus so much on other things. We sometimes neglect the most important thing that we have, which is our bodies. And so take care of it. Go get checked. So here we are. We're about ready to hit the road to drive back to Arizona so that she can do her 3rd chemotherapy treatment. She's already done 2. And we will talk a lot more in detail about that, whatever she's ready to share in the future and upcoming videos on and all of this, because there's so much to talk about. But she has been through 2 chemotherapy treatments, 2 of 16. So like she said, it's a 5-month program, and there have been many side effects, and you may not notice it now because she looks amazing, and it's not just her looks, but it's her spirit. She exudes just strength and goodness, and I've been truly impressed. I can say that I've always known that my wife was strong and amazing, but I've never truly seen it to this level, and it's been such a testimony to me that I married the right person. And part of why we want to make these videos was that, of course, to bring awareness to others. But I mainly wanted to document this and keep them so that I could show my kids how strong their mom was, how positive. And I've never seen such gratitude from my wife. And I know that she's been given strength from God. I know she has. Just with her spirit, her attitude, her resolve to continue forward, it's been truly a joy to see. And it reminds me that we're never given a trial that we can't overcome. And I do feel like this is all a big test. That's why we're here on earth, to be tested. That's the whole purpose of life, to be tested, to grow, to learn, to increase in knowledge and experience and move forward. And that's why we are here. And we know that we will get through this. We don't just believe it. We don't just hope it. We know it. We know that one day we will be parents to a full family. We know it. And we're grateful for this strength and this hope and faith that we've been given. And we do know that that also comes from God.
I think in life, we are given challenges and trials for a reason, and I think it's an opportunity that we have to really narrow in our focus and our perspective and remind ourselves what's truly important. During this time, there's been a lot of prayers that have been said. There have been a lot of blessings that I've been extra aware of and extra mindful of and extra grateful of. And I know, especially like the first few weeks of the diagnosis, I was praying 500 times a day for every little thing and giving thanks for the biggest blessings and the smallest blessings. And I know that God gives his hardest trials to his strongest soldiers, and I repeat that in my head day in and day out. And I tell myself, I am going to beat this. I will overcome this. I'm strong. My body is healthy. I'm young. The strength that I've had to get through the day-to-day things and get through, the diagnosis and then the first chemotherapy treatment and then the hair thinning and the big traumatic events that have happened within this diagnosis, I have felt an extra strength and an extra love and an extra amount of positivity that is 100% credited to God, because we're human and naturally our minds go to the, oh, why is this happening, or I'm only 28, or whatever it is. And I think we can allow ourselves to go that route, or we can change our mindset and say, okay, well, it is what it is. This is what has happened. We can't go back and change things now, so the only way we can go is forward. And the best way to go forward is with a positive attitude, because having any sort of negativity isn't going to help me mentally, emotionally, spiritually, even physically. It's not going to help my body be able to process or release or whatever it needs to as I go through these chemotherapy treatments to rid the cancer from my body. And I'm so grateful that I've felt the hand of God in my life, the strongest I've ever felt it during this time, because it's a hard thing. Hearing that you have been diagnosed with cancer is extremely hard to hear. I think that's one of the most feared words people have, is the cancer word.
So yeah, we both have heard doctors tell us that we each have cancer. I don't think it's a coincidence that we're on this journey together, and we know that everything will be all right. We have been so busy lately as well with home building, with design. Me and Delia are completely designing a home that's going to be in the parade of homes in the next couple of months. So we've been very, very busy, and she's done such a good job just keeping herself busy and still working, and amidst taking care of everything else. It's been a lot, which is why
another family we're helping design too in Texas, and
yeah, so
they're awesome too.
An amazing family. They saw our home tour video and loved our home and wanted us to help design their home. So that's been awesome.
Yeah, we're so excited for them.
We have a lot of exciting things coming up, and home tours, design tours, and so much stuff that we want to be talking about and sharing with you, but it needed to take a break. This obviously takes precedent. So we finally come out and spoken about it, and there's a lot more that we will share in terms of the treatments, her hair loss journey and such.
There's so much to it. Like, there's so much more information I want to give to you guys, but we'd be here for hours. There's so many things that go into it. So we will try and keep you updated as much as we possibly can, as well as with our jobs too and with work, because that's actually been really exciting and really fun and a good distraction for me. But we wanted to share everything with you, as much as we know and as much as gone on so far, and keep you guys in the loop and updated with things. And we just want to again say thanks for support and for being here and being part of this new journey that we get to go on together. Please go get checked out. Please just go to the doctor and get a body scan, get your blood test done, get imaging, women, men, whoever it is. Just stay proactive and on top of your health because it's so important. So thank you guys, we love you, and stay healthy and happy.
Remember that life is beautiful.
Infusion 3, and Dylan was able to make it down this time. The other 2 times my mom dropped me off, but Dylan was here this time, so he was able to bring me in, and unfortunately with COVID restrictions, he's not able to come in with me this time, but hopefully at least one of my infusions will be able to come in. Maybe if it's here or Utah, we'll see. But here we go, infusion number 3.